So I'm Colin Smykel. I am the medical director at Laura Fertility Care. We are an office in San Francisco. We've been providing care for patients for quite some time. We have several patients who have been from Israel, and one of the reasons why I came to visit Israel was to visit them, and this was a secondary benefit from that. So basically, since it's a small group, I'll try to answer questions rather than actually have a presentation to tell you about what we do. One question that came up earlier was cost. So many times with couples going through, we'll actually share eggs, so therefore both partners want to actually create their own set of eggs. So that's actually one way to consider things. If one individual is actually going through, the typical cost per cycle is about, let's say, $13,000 to $15,000, not including the medicines. Many patients from Israel who are participating in care will often get their medications here, so that reduces the cost significantly. One question came up earlier was, how is that possible? I'll be honest to say that I don't know. Many times they'll have physicians here order those prescriptions and deliver it to us, and we provide it to either to the donor and many times the surrogate as well, and that reduces the cost considerably for the cycle. Another question came up relates to success, and typically in one cycle, the one first cycle, including delivery, not including frozen embryos, success rate is greater than 60%. One thing that many couples will commonly start doing now is doing the genetic testing, that pre-implantation genetic screening. That increases the success because we know a lot more about each of the embryos. So therefore, in transferring a single embryo, success is greater than 60%. In transferring two embryos, the success is greater than 80%, but the twinning rate is greater than 40%. So that's actually one thing. Because of the expense, some couples will actually consider choosing a surrogate who can carry twins, and the surrogate would then have to understand that she has a higher chance of having twins, and therefore both couples can have their families if that's what they choose. I've had many couples in Israel who basically had 5 or 6 children. Seems like a lot to me, but that's a different consideration. But those are the typical costs that we have. We do not have an internal egg donation agency, so we work with several outside egg donation agencies. One thing that...
Where from?
I'm from San Francisco, here from San Francisco. So therefore the office is in San Francisco.
And your agency is based where?
No, we do not have an egg donation agency. So
no, but your agency or?
My office is in San Francisco, San Francisco, California, United States. One thing that came up very differently because of a request from a specific parent here, there is a concern in terms of using a pool of donors who they are concerned will then provide many eggs to many patients. And so what we did recently was to pair that couple with another patient who may want to go through IVF for her own reasons. And we worked with an attorney, the attorney is here during this visit, who has worked to create a donor cycle, if you will, but a unique donor cycle where the couple will then meet the donor and have a different relationship, but also be less concerned about having multiple siblings outside of that relationship. Because the donor will have her family, and that couple will actually have their family, but that donor is not going to be a donor for several other couples. So that's something that is somewhat unique to, but also based on a request from someone here. It was something that we never understood or considered before.
And the egg donation can be limited if to limit one donation to Israeli couples and
This was something that the situation came up where I had a patient who had gone through and it was not successful with her cycle because we call a mini cycle, so she didn't get many eggs. She was still makes lots of eggs, but what she did was she was not able to pay for a cycle right away, but she wanted to consider going through. I reached out to her and asked if this couple was interested. They did not want to go through an agency. They did not want a donor. And so we matched her with the donor, with the intended parents. They talked and exchanged information for some time. And then when she did the cycle, they basically were the only ones, and not only in Israel, but the only ones that she'll actually donate for. She's not a donor from a donor agency. So many donor agencies, a donor will actually donate 4 or 5 times. She is only donating, she's creating her family, and she's only donating for this couple. And she's also arranged to be open to meeting the couple later on. But many things can change. But that's a unique situation. That is unique. We were in Jerusalem yesterday, and they found out their pregnancy test was positive, so it was rather elated, but we'll see.
Can you describe a bit the process? I mean, I know it's
The process
might be obvious, but just because we are just very fresh in this.
So the process of egg donation, or
Maybe everything.
Okay, so starting up, so you're the individuals who choose start the entire process. So you're new to everything. So you'll need a surrogate because someone will have to carry the baby.
Mm-hmm.
That's a more intimate relationship because that's the entire length of the pregnancy. And you can either have a donor who's providing the eggs, and typically the donor will actually be, it could be a sibling. So let's say, for instance, not to pick on you, but both of you are actually going through. And let's say that you both wanted to actually keep the genetics internal. You had a sister, and you want to have your partner have the egg. So therefore, he would go through and provide sperm the first time with your sister being the donor. And we've gone through that part before. And we've done that many times successfully. Or it could be an anonymous donor, someone who is not really participating in any way. The beauty of the anonymous donor is that you both could share and pool into one cycle. So therefore, both sperm could be used to fertilize a certain number of the eggs. And conceivably, it would also reduce costs because then one surrogate would carry both embryos for each of you. So therefore, from one cycle, if you wanted to have 2 kids and only 2 kids, then that would be one way, one less expensive way of going through the process. So that's one way of doing things. But in selecting the donor, in the United States, the government controls some regulations related to donations. So therefore, there are some specific rules we have to follow. And so you'll choose the donor, we'll match the donor, we'll basically do all the testing. Some of the testing, I put information that describes what's there, but it's just infectious diseases. And then the donor goes through a cycle where she takes medicines to stimulate the ovaries. If
The donor?
The donor. So therefore that's where, and those are the expensive medicines. So therefore she takes medicines basically because you want to retrieve typically someplace between say 15 and 20 eggs. If you're both trying to participate, you may want to have 30 eggs, so therefore you'll have a sufficient number. But in order to do that, she needs to be able to take medicines for quite some time.
For what?
To stimulate her ovaries to make those eggs develop. Without doing that, she'll only create 1 egg, which doesn't do much good. So she'll take the medicines to stimulate her ovaries. We'll then basically monitor how that's done. We'll get those eggs. We'll have your sperm already frozen, so therefore the day that she gets those eggs, we'll then fertilize those eggs, and then we'll basically create embryos, and those embryos then go into the surrogate. If it's going to be a fresh cycle, so therefore the both of them are cycling simultaneously, then the donor will be taking medicines to get her ovaries ready. The surrogate will be getting the uterus ready, and will basically make sure that they're timed simultaneously. So when the donor goes through and gets the eggs, the surrogate starts taking medicines to accept the embryos, and then we transfer the embryos to the surrogate. Your relationship with the donor is now finished, but the surrogate is in their relationship when she continues, she gets pregnant. That's the one that you're going to be keeping in contact with. That's the one, if you're working with an agency, they'll actually want to make sure that you're following up with, and then they'll follow you through, and then the baby is delivered. In the United States, there are many laws that protect the relationship, so therefore, in California, both dads can actually be on the birth certificate, and the donor and the surrogate is not, so you'll have that as a way to kind of document the birth of the child.
And it's valid also as you come to Israel or not?
Oh yeah. Oh, definitely. It's actually great. So some of the most protected places to provide surrogacy, California is one. It's actually one of the first to actually provide surrogacy, and they created many of the laws that other states follow. And many surrogacy agencies will have surrogates in California, so the baby's born in California. But then when the baby is coming to Israel, it's a shorter time span than if you're going other places. After, you might well know, after the birth, then for the child to come back to Israel, there's a blood test that needs to be done to confirm that you're indeed the parent before the baby can come back. So that's actually done as well before.
And then also to supply documents like passport for the baby.
Most of that's are legal contracts that are done well before. So therefore, by the time the baby's born, most of that stuff is actually done. And that the surrogacy agency you work with and the attorney that you work with should prepare all those. So therefore, by the time the baby's born, you're basically, all those documents are done. You have actually filed all the information. You've gotten everything. So as soon as the baby's born, the baby's now transitioned to you. So
how long since the birth, basically, until you can leave
the country?
United States?
Typically, it's less than 2 weeks. So therefore, and there are couples who it's shorter than that because much of the work is done before. Legally, once the baby is born, it is your child. So therefore, all the information and all the documents need to be in order before that birth. Usually it's done, so a pregnancy is 40 weeks. Most times that information, all the documents are done before the 30th week, so therefore anything that happens that occurs during the later part of the pregnancy, you're not going to actually be caught off guard. So much of that information is going to be done well before, so you'll know all the information and you'll be protected. So after the birth, baby is yours in every way. And so therefore legally, medically, from an insurance standpoint, you'll have to create insurance plans so therefore the baby gets covered. Because most times the insurance will cover the donor, the insurance will cover the surrogate. The baby is going to be your responsibility, and it's not going to cover the baby. So that's one of the reasons why you'll actually have to basically make sure that you'll have to have a special plan, and that's get covered many often. That gets covered many times, and there's special insurances for that as well.
What is the statistics out of like 20 eggs? How many embryos?
Because most of those embryos, so the question is from those 20 eggs, typically how many embryos do you get? It depends if you're splitting them or if you're using them all for one individual. Typically from those 20 eggs, you'll have about 15 mature ones. Of those 15, you'll probably create about, say, 7 to 10 embryos. If you culture that further to the fifth day, you probably have, say, 6 to 8. So therefore, of those 6 to 8, roughly half are going to be good, half are going to be not good. So therefore, that's one of the reasons why many times you'll transfer 2. If you did genetic testing, you would know how many of that 8 are normal, and then you would only transfer the genetically normal embryos. So therefore, of that group of 20, you'd expect about 4. And therefore, typically.
And there's risks in those genetics testing?
There used to be more risks because the testing was done on day 3. Now the embryos are actually cultured much further, and so the testing is done around the 5th day, and it's also removing a part that is becoming the placenta, so it does not affect the baby. It's much safer, so therefore the pregnancy rate is higher, the success is higher, there are no missing limbs, you're not really going to destroy anything from the embryos, so from that perspective it's a lot easier. And the pregnancy rates are much better, so that's one of the reasons.
All the process you mentioned before, is it more complicated in the case of twins?
Twins are typically, they're born a bit earlier, so that's one, and that's actually a different subject in making sure you choose the right surrogate. So the surrogate has to be healthy, the surrogate is not as likely to have a cesarean section. Anything that's going to basically, she needs to have delivered before. So anything that will actually allow us to determine that she's a good surrogate is the one that's going to host a pregnancy a lot more.
Okay,
So
2
that's
minutes.
okay. So that's a bit of concern.
And you mentioned before about the blood test that has to be done in Israel.
No, Israeli law requires that it be done. It's done in the United States, and then the paperwork is sent to Israel to confirm. Israel is not going to let you in before they confirm that it's there. That is the law.
Okay.
So therefore, in other countries that doesn't require that, it's done easily. In Israel, specific Israeli law, you have to have that.
Do you work with many couples or many people in general from Israel?
We do. Again, I've been working with clients for probably more than 10 years, so therefore this group is actually much. My first time to Israel was a family who basically many of their relatives hosted what I did. So there are probably over 20 families here. So many of them are willing to talk to individuals. It's hard for me to basically then ask them, but if you want information, I can actually happily provide information for them to talk to you. That's fine.
So what would be the average total cost of this procedure, this process?
So I'll separate those into separate parts because it makes for our part, the ones that we control, roughly, if you're using, say, one person's sperm and everything else, our part of it is around 15,000. The 2-person sperm is probably closer to say 20 or 25,000, but that's roughly the cost for everything. It may be a bit less, but I'm just trying to give you all that information. The cost of the medicines is probably another 5, and the cost of the surrogacy is the most expensive part because the surrogacy is typically between, say, on the low side 50, the high side close to $100,000. So therefore, budgeting. And that's one of the reasons why many patients will actually consider going to different parts of the world because it's less expensive, but it's also fraught with a lot of other issues that are not, because it's never been done in the United States.
So actually you're not a one-stop shop, that you have to go with an agency and...
Actually, so therefore, we work with several, let's say you came to see me. We would work with a surrogacy agency, a lawyer, everyone, so we would all come together to support you rather than you having to go out and support and find everyone on your own. Or let's say you found a surrogacy agency. Many surrogacy agencies have places that they work with, so that's the same thing that they do.
So the payment is to your agency and then you take care of everything?
Many times it's the other way. The surrogacy agency is where you'll actually have the escrow account, and the escrow, so you might actually pay the surrogacy agency and they'll pay us directly, or you'll pay us directly for the medical services, but the surrogacy agency typically contracts information for the donor and the surrogate. So